Good afternoon, and thank you for joining us again today. I will start with the usual update on today's statistics. The total number of positive cases yesterday was 969. That represents 4% of the total number of tests and takes the total number of confirmed cases in Scotland to 93,155. 315 of the new cases were in Greater Glasgow and Clyde, 201 in Lanarkshire and 121 in Lothian. The remaining number of cases were spread across 9 other health board areas. I can also confirm that 1,099 people are currently in hospital. That is a decrease of 26 from yesterday, and 80 people are in intensive care, which is a decrease of 10 from yesterday's number. But finally, I regret to report that 37 additional deaths have been registered in the past 24 hours of a patient who first tested positive over the previous 28 days. That takes the total number of deaths under this measurement to 3,676. Each one of those deaths is the death of an individual for whom people are now grieving. So once again, I want to send my condolences to all those who have lost a loved one during this pandemic. I'm joined today by the Chief Nursing Officer, who will be helping me to answer the journalist questions shortly. But before that, there are a few items I want to update you on. The first concerns international travel. The Scottish Government announced last night a number of changes in relation to quarantine requirements. 2 countries, Estonia and Latvia, have now been removed from the exemption list. That means that they will now be subject to quarantine requirements. As a result, from 4 a.m. tomorrow, anyone travelling to Scotland from Estonia or Latvia will be required to self-isolate for 14 days on their return. There are 2 other points worth noting. First, the travel ban on visitors from Denmark will also be lifted from 4 a.m. tomorrow. The ban, as you will remember, was introduced following the discovery of a new variant of COVID, which originated in the mink population. The view of the UK Chief Medical Officers is that the risk associated with Denmark is now receding. However, Denmark is still subject to quarantine requirements. We also announced last night that a number of countries and territories have been added to the exemption list, and details of those are available on the Scottish Government's website. All of these changes underline an important point, that while the virus is resurgent around the world right now, there's significant variation between countries and areas, and as we've seen, the situation anywhere can change very rapidly. That's one of the huge challenges we face in dealing with this pandemic, and it is, of course, why we continue to advise very strongly against non-essential overseas travel at the moment. My second update concerns our text message service for people in the shielding category. We're aware of 2 incidents where a message was sent by someone pretending to be from the texting service, asking for people's personal information. We are, of course, investigating this as a matter of urgency, but I want to take the opportunity today to remind everyone that the Scottish Government will never send a text message asking for sensitive personal information or banking details. So if you've signed up to the shielding text message service and you receive a text asking for financial information or passwords, it is almost certainly a scam. Anyone who receives a suspicious text or call of this kind can report it to Advice Direct Scotland. And if you are unfortunate enough to have been a victim of a scam, you should contact the police by calling 101. Sadly, instances like this are not unexpected. There will always be a small number of people who seek to exploit any situation they can to defraud others. But we will continue to do everything we can to prevent this from happening. The final issue I want to cover concerns the well-being of our health and care workforce. For more than 9 months now, health and care workers have been at the very forefront of Scotland's response to COVID-19. Throughout that period, they have done and continue to do an outstanding job in the most challenging and stressful of circumstances. In recent weeks, of course, the pressures on our health care sector have intensified significantly. Right now, they're having to deal with the impact of a second COVID-19 wave, as well as the emerging challenges of the winter period. Now, it's clear that the vast majority of health and care workers are coping, and they're coping well right now. But we know these kind of pressures take their toll. The Scottish Government is determined to do everything we can to support the mental well-being of our health and care workforce. That's why in May we launched our National Wellbeing Hub. It provides online support for health and care workers and their families, as well as unpaid carers and volunteers. The Hub has a range of digital resources designed to help with, for example, managing stress, improving your sleep, enhancing your resilience. It also has information on a range of other advice and support services that are available. Since its launch, more than 53,000 people have used the National Wellbeing Hub. So if you need a bit of support, please don't hesitate. Encouraging you to visit it at www.promise.scot. That's promise, PROMIS.scot. There is also a dedicated national helpline for health and care workers, and I'll read out the number for that in a moment. The helpline allows workers to talk to a team of psychological well-being practitioners. They'll provide a sympathetic and listening ear, whilst also providing advice and referring you on to local services if that's what's needed. The line is open 24 hours a day, 7 days a week, and it's available to all health and social care workers. So if you're feeling stressed or anxious and need support, you can call this number. It's 0800 111 491. That's 0800 111 491. The overall message I want to get across today is that it is okay not to be okay. That's as true for health and care workers as it is for all of us. So if you're struggling at the moment, please use the help that's available. And if you're someone who doesn't think you need help right now, you can still take steps to protect your health and well-being. Scotland's health and care workers have done a magnificent job, and they continue to do it, protecting and caring for people during this pandemic. It's really important that all of you know that there is support for you too. So those are the three main issues I wanted to cover today. But let me finish by reminding everyone of the key rules and guidelines for staying safe. Remember, if you're in any doubt about what those rules are in your local authority area, you can use the postcode checker on the Scottish Government's website. But nobody outside of Orkney, Shetland and the Western Isles should be visiting each other's homes except for very specific purposes, such as childcare. If you do meet people from other households, outdoors or in public indoor spaces, the limit is 6 people for a maximum of 2 households. And in addition, please avoid car sharing if you can. Work from home if you can. Download the Protect Scotland app if you're able to. And finally, remember facts. These 5 key rules that we can all use to reduce our chance of getting the virus or of passing it on. They protect us and they help us protect each other. So remember face coverings, avoid crowded places, clean your hands and clean hard surfaces, keep 2 meters distance from people from other households, and self-isolate and get tested immediately if you have any of the symptoms of COVID. And please do more than remember them. Please practice these. They help us to protect ourselves, to protect our communities, and to protect the NHS. And they will save lives. Thank you to everyone who is doing that, and please continue. Now, that's me with my introduction over. Let's go to the journalists who've joined us for questions, and the first is Bruce Mackenzie from ITV Border. Bruce.
Thank you, Health Secretary. Today we've seen a couple of MSPs and MPs of border constituencies looking to reassure their constituents who are needing to cross the border for essential purposes. Now, they say they've had reports that some people crossing the border have been stopped by police and asked what their reason for the journey was. I just wonder if you could give us any advice to reassure those people in border communities that if they need to cross the border for essential purposes, that they're okay to do so, and that they won't face the threat of being stopped by police.
Well, obviously I can't comment on the operational steps that the police take. That is entirely for them to do. But if police do stop you or they ask you what you're doing, they are doing that as part of making sure that you understand what the rules are, and they'll be encouraging you to comply with those rules. And of course, there is restrictions there on travel, but there are also exemptions. And the exemptions for essential travel include travel for work or travel to look after a vulnerable adult, provide care, and those are perfectly acceptable exemptions. So the police will do the job they need to do, and they'll do it as well as they have done right throughout this pandemic. But we all need to know what the restrictions are that matter and apply to us, but also to know that there are exemptions in certain instances. So, Ross Govens from STV.
Afternoon, Cabinet Secretary. Can I ask you about the possibility or the consideration being given to extend the school Christmas holidays? Is this an indication of the tougher measures that we all potentially will face in January as almost as a trade-off for the relaxation over the Christmas period?
No, it's not. It's part of the expert recovery group that have been working with the Deputy First Minister and others, including the unions involved in representing teachers and local authorities, to look at how we can maintain our commitment, which is really important, which is about keeping our schools open so that our young people can have the opportunity to learn and to be part of normal school education. Now, that recovery group has been working all through the summer to give us the best advice that they can about how to ensure that we can keep schools open. They're looking across, they looked at the end of the summer holiday period, the return of school, the lessons we have learned from that and what more we can do. And they're obviously looking at how we enter the festive period and the school holidays and how we return to school at the end of that holiday period. So that is work that we would require and expect and hope that they would do, because we benefit greatly from it, regardless of whether there was any easing of restrictions over the festive period. So that's the work that they undertake. They will come to their conclusions, and I've no doubt that the Deputy First Minister will set out the steps that he wants to see schools take for a successful return after the festive break. Aileen Clark from BBC.
Afternoon, Cabinet Secretary. If we can just stick with schools for the moment then. Obviously, parents will need to make arrangements. So can you give us some idea of when parents will be told whether their school holidays are going to be extended? And also, can you give us a wee bit more detail on that? Is this being looked at because it's thought to be a way to help flatten any spike in January? Or is it because it's a practical measure because it's thought that there'll be a lot of teachers absent? And with that in mind, if you go down this path for schools, is it likely then that that might be extended to elsewhere in the education sector, like universities and colleges? So
on your first part of your question, Aileen, yeah, we're very conscious that, of course, parents and teachers and kids at school want to know what is going to happen. And we will make sure that we reach a view based on the advice from that expert recovery group and make sure that we reach a view as soon as we can so that people do have advance notice. I think it's 4 weeks today is Christmas Day. So we want to give people as much notice as possible if there is to be any change at all. But at this point, that decision hasn't been reached. On the other parts of your question, we look all the time at all the steps that we think we need to take in order to minimise and suppress the virus as much as we can across the country. That includes our strategic framework and the levels that local authorities are in. It includes, really importantly, constant repetition of that facts guidance that I gave, the advice that we give to different sectors, and the work that is undertaken by us in discussions with Universities Scotland and colleges, with schools and all those who are involved in schools, and importantly with our local authority partners. And in all of that, we've got the data that we draw on, but we've also got the expert clinical advice in schools. It's that recovery group. But here in government, we've got expert clinical advice from colleagues like our Chief Nursing Officer and others that you've seen at these briefings. So we draw on all of that, and we look at this all the time. It would be wrong to overly speculate or jump to conclusions simply because we're looking at different issues. But at the moment, both the Deputy First Minister and his colleagues will be working through what they think is the best way for schools to enter the Christmas break and come out of the Christmas break, and that applies to schools and to colleges and universities as well. Catherine Bussey from PA.
Good afternoon, Health Secretary. I wanted, if I may, to ask about the coronavirus vaccine. There's been some UK-wide research done which suggests that something like 64% of the population would be likely to have the vaccine. Now, I know that for some other vaccines, there's a much higher uptake target, I think of 95%. So would you be concerned if the uptake of the coronavirus vaccine was about 2/3 of the population? Would that be problematic?
Well, my objective is to maximise the number of adults over 18 who take up the vaccine, and to make sure that as soon as vaccines are available to us, we're ready to deliver those based on the advice that we get from the Joint Committee on Vaccines and Immunisation, and deliver those to people as quickly as we can, as accessibly as we can, because it's important that people can easily get the vaccine without too much difficulty. So I am not setting a target on this at all. The objective is to get as many adults as possible to take up the vaccine. Now, part of what we need to do is explain to people how vaccines are tested and trialled so that we're all confident in their safety. I am confident in their safety. The MHRA, the regulatory body, will not approve them if they don't believe that they're safe. And the JCVI will give us good clinical advice about who should be vaccinated in what order. So we need to make sure that we're giving lots of information to the public. We will plan to do that in an early household drop to every household, information to every household in January, so they know about the vaccine, they know how to be vaccinated, what to expect in their local area, and then obviously you follow that up with individual appointment letters and arrangements and so on. And the other group of people who are really important that we make sure we vaccinate them first, of course, or in that first cohort, are health and social care workers. And perhaps Fiona might want to say a little bit about why it's important that they are vaccinated and that we make it accessible for them to do that.
Thanks, Cabinet Secretary. I think it's important for people to remember that being vaccinated against COVID gives you huge protection against this disease. And if you were to ask any of the grieving families who have lost loved ones, I'm absolutely confident that they wished that vaccine had been available earlier for them. It is absolutely safe. The quickness of time that the regulation or the regulations and the research have taken has been due to funding. The researchers and the manufacturers have worked incredibly closely so that we can have a safe vaccine, and as the Cabinet Secretary said, they will go through all our normal safety procedures. The health and social care staff, we know, have been, during at least the first wave, more at risk of contracting COVID-19. So it's essentially important that we protect them and give them that offer of protection, which in turn should also protect their patients. And we're very keen keen that our health and social care workforce take up this vaccine that gives them the protection from reducing death, reducing illness, and we would expect to see that rolling out in the very near future.
And the other thing I'd say just before we go on to our next journalist is that, as Fiona said, that this virus, and we all know this by now, this virus will take any opportunity it can to infect someone. The vaccine, and for some, the consequences of that are incredibly serious. Very serious illness, death, and if people survive very serious illness, then we know increasingly about the phenomenon, if you like, of long COVID, where we've got many people who continue to suffer from the after effects of the virus. The vaccine gives us a level of protection, a layer of protection that we don't currently have. There are layers of protection that we do currently have, that we have in place, but the vaccine adds to that. So it is really important that if you are offered a vaccine, when that letter comes through offering you the opportunity to come and be vaccinated, that you take that up. It is safe, it is proven to be effective, otherwise it would never be approved in the first place, and it helps you protect not just yourself, but protect those that you love. Mark McLaughlin now from The Times.
Good afternoon. This morning, Jason Leach advised elderly people to sit out in their garden and drink champagne on Christmas Day. The winter mortality study that was released earlier on this year said that the countries that did worst over winter mortality tended to be the countries that didn't wrap up warm, whose houses were poorly ventilated. So could you just reconcile those two statements, advising old people to sit in their gardens and the winter mortality advice?
So I think the National Clinical Director gave a lot of very sensible and wise advice today when he was on the radio, as he very often does, about the practical steps that people can take over the festive period to keep themselves safe. Now, we've allowed a degree of flexibility over those 5 days. We've said clearly you need to think through individually your assessment of the risk to you of using any of that flexibility. And if you do use it, how can you do that as safely as possible? And that was what the National Clinical Director was doing and will continue to do. We know that the virus is less prevalent or less difficult to control if we're outdoors, that ventilation indoors is really important, that maintaining physical distance is really important, using face coverings, washing hands and cleaning hard surfaces, all of that matters. So practical advice to people, but you know, people in Scotland are increasingly well informed. They have, thankfully, been watching these briefings for many months now. They've been reading a great deal. They've been listening to what's being said. They understand the risk of this virus and how it transmits itself from one person to another. And so they will have questions about what might I do in this circumstance or that circumstance. As a government, we can't legislate or advise every single circumstance that people might be in, but we can give them good advice and good guidance on the basis that we are adults talking to adults, and people will make their own judgments and take their own decisions about what they think is best for them in their individual circumstances to minimise the risk to themselves and to their loved ones. But the other thing to remember about all of this is that the rationale for doing it is to recognise that there are many people across Scotland who are alone and lonely, and Christmas is always a difficult time in those circumstances. So what we're trying to do is balance giving people information so they can make decisions about the level of risk that they want to take and how they mitigate against that risk, whilst also recognising that many families and individuals will want to make sure that one of their friends or one of their loved ones doesn't have a lonelier Christmas than they might otherwise have. Scott McNabb from The Scotsman.
Are you safer in a sub-zero garden than inside your house on Christmas Day?
No, I don't think we are saying that, and I don't think Professor Leach was saying that. What he was making a point, I didn't hear what he had to say, but I'm sure he was making the point that outdoors is safer than indoors, and that's why we say if you're indoors, then please make sure that it is well ventilated, that you have windows and, if possible, doors open to allow air to circulate. And of course, if you're outside in November or December, then all of us know, any of us who have lived in Scotland for any length of time, know that you need to wrap up well, certainly in November and December, and sometimes in July and August. So, Scott, from the Scotsman.
Thank you, Cabinet Secretary. The Oxford AstraZeneca vaccine candidate has been sent to regulators today, but it comes amid growing concerns among some scientific experts about the data which lies behind this candidate, particularly the 90% efficacy finding over the different dosages. The company themselves have now said that they're going to have to go off and conduct further testing. Is that something we should be concerned about for the wider rollout and timescale of vaccination in Scotland?
Well, I think too, thanks for the question, Scott. I think too that the company has also said that they believe that they can undertake any additional trials that might be needed without delaying the overall timescale. And part of that, of course, is, as Fiona said a few moments ago, about the global effort that has gone in to making sure that vaccines are go through all the proper clinical trial processes, all the data that is collected, but in a much shorter time frame than we have seen in normal times, if you like. And that's basically the scientific research and medical community's incredible response to helping us deal with this pandemic. But the regulators will look very carefully at all the data. They are themselves experts in this field. They will look at all the data that any company produces as a result of all these trials. They will question that data. They will ask for more if they believe that they need that. And only when they are absolutely satisfied that the vaccine that they are looking at is safe will they approve it for use. So we can be confident in the rigour of that process. And in terms of whether or not that in the end, there are a number of vaccines, as you know, that are coming towards the point of being presented to the regulators for approval. Whether or not that makes a difference to the delivery timescale, we won't know that until the regulator gives approval for different makes of vaccine, but the same vaccine that comes through. What I need to do, and what government is doing with health boards and with our local authority partners and indeed with the third sector and the armed forces, is making sure that as soon as a vaccine is approved and the supplies arrive in Scotland, we are ready to begin vaccinating the population. And that's the work we're focusing on whilst we wait for the regulator to do the job that they are very well equipped to do. Next, we have Dan Vevers from The Sun. Dan, my apologies if I've mispronounced your surname.
You got it right the first time. Thank you for that. Good afternoon to you both. Could using the NHS Louisa Jordan for COVID patients have eased the burden on hospitals, given we're now seeing a rise in hospital-acquired COVID on wards? And what's being done to prevent the spread of COVID in hospitals? And do you regret not listening to calls to test all health workers, particularly those in patient-facing roles, sooner? And secondly, just for you, Health Secretary, given you're stepping down as an MSP before May's election, and the COVID vaccination programme will likely still be going on around that time, do you think you should appoint someone else who can oversee it until the end, given how important it is?
Okay, I'll go to Fiona for more expert response in terms of nosocomial infections in our hospital setting. And just to answer a couple of your points, so before I do that, we already do test patient-facing healthcare workers in a number of specific settings, and the settings were chosen on the basis of advice from the group that I'm sure Fiona will talk about, of experts who advise us on nosocomial infection. So the current groups of healthcare staff who have been getting tested for some time now are patient-facing healthcare staff in oncology, in long-stay care of the elderly, and long-stay mental health. From December, we will, as I said this week, extend that testing to all patient-facing health and social care staff. That is in addition to the testing that we do, the weekly testing we do for care home staff. And again, we've been doing that for some time. We're able to do that extension because we now have access to greater capacity in terms of our labs through the increase in NHS lab, through the 3 new regional hubs that will come on stream early next month. Also through the increase in testing capacity from the UK government's Lighthouse Lab in Glasgow and the introduction of new testing technology, the lateral flow devices. All of that then allows us a fairly major expansion of the testing programme that was announced by me on Wednesday that also takes us into community asymptomatic testing in areas where we've got stubbornly high prevalence of the virus to try and chase down cases and break those chains of transmission. So that's why it's not that our face was turned against testing, but we needed to have the increased capacity and particularly that new form of testing, which is quick, in order to be able to expand it as we are doing from the beginning of next month, so from next week. In terms of Louisa Jordan, you remember in this phase of the pandemic, we're trying to do 2 things. We're trying to ensure that we have the same level of capacity to respond to COVID cases in ICU and in hospitals as we had in the beginning from the early part of the pandemic, but also to do that by not stopping other healthcare services. So we've always had the priority that we would respond to COVID cases, but we would also be able to treat emergency, urgent, particularly urgent cancer and trauma. That continues, but we don't want to continue to pause other important healthcare services. So it's a constant balance across our whole health service. Different parts of our country are more pressed at the minute on COVID cases than others. So we need to balance all of that. And the Louisa Jordan, which at this point we do not need for COVID cases, but we keep it in case we do. And whilst we hold on to the NHS Louisa Jordan, we are using it in order to treat some of those non-COVID healthcare patients who have waited a long time for diagnostics or for particular forms of treatment. So the Louisa Jordan is playing a big part for us in providing that COVID-free environment in order to help those patients who've waited a long time for their health care that isn't related to COVID. On the nosocomial question, we do a very great deal based on expert advice to try and minimise the level of COVID infection in our acute settings. But remember that when there is high community transmission, then you will see that seep over into settings like our hospitals. But a lot of work is underway, has been for some time, and Fiona, I'm sure, will bring us all up to date with that.
Thank you. And Professor Jackie Riley chairs our expert nosocomial review group, which is one area where we get expert advice on, in practical terms, how do we minimise, if not eliminate, healthcare-associated infection associated with COVID-19. We also have a specialist infection prevention and control team who provide national advice, and the combination of their advice is taken. They look at international evidence, they look at the data that we have across the UK, and are constantly giving advice. You know, Jackie Riley's group, the minutes are on our website, so people can follow the advice that they're giving us and see how we then respond and implement that. What we do know is that the clinicians have told us that they would prefer to look after their own patients end to end rather than necessarily use the Louisa Jordan for COVID patients. The hospital is there as a temporary facility, as a safety net, so that were we to need it for COVID patients, it's there, and is an incredible reassurance for us to know that we've got the capacity in Scotland. But at the moment, our hospitals right across Scotland do have the capacity both within our acute medical admission wards, our intensive care units and our high dependency units. The whole issue of the PPE that we now recommend, and again, when you go into hospitals now, although we've got used to the PPE that clinicians and support staff wear this time last year, it looked quite different. The way that we have red and green pathways, where we, as far as we can, keep the COVID-free patients, either the elective patients who've had their tests or those who've had an emergency, go into the red pathway. And we work very hard to make sure that the hospital-acquired infection and of COVID-19 is as small as possible. No healthcare is risk-free, and for years now, health boards report on their NHS board that one of the first things they do is report about healthcare-associated infection and infection prevention and control. And that has been a tradition over the years where boards take it incredibly seriously, and we look at how we improve to reduce and minimise healthcare-associated infection. Unfortunately, it is an inevitable part of it. In Scotland, we are one of the few countries who publish that data on a weekly basis so that we can be open and transparent about it. And again, our National Infection Prevention Control team will be very shortly publishing more details of outbreaks. What they have told me is the outbreaks that we're seeing now compared to the first wave are being much more readily identified and shut down much more quickly, and they will also be publishing background notes so that we make sure that there's national learning from how we can reduce even further these healthcare associated infections but outbreaks of COVID-19.
Thanks very much. And can I just add 2 additional points to what Fiona has said? I talked a minute ago about increasing testing for our health and social care staff who are patient-facing, but we are also introducing testing for all emergency admissions and all planned medical and surgical admissions. All of those, now that we have the additional testing capacity, all of those are additional layers of protection to try and prevent the virus entering our hospital settings in the first place, remembering that there will always be occasions when it does. The key is, as Fiona has just said, to identify that as fast as you can and take all the necessary steps, which our staff are so skilled in doing, in order to prevent onward transmission once the virus has entered the hospital, perhaps in a patient who was asymptomatic and the test didn't show that at that point that they had the virus. Thanks very much. Michael Blackley now from Daily Mail.
Sorry, I just had a follow-up about
All right.
your departure next May with the vaccination programme and so on.
I didn't want you to remind me that I was departing next May. These decisions are for the First Minister to decide. She decides, of course, as she rightly should, not only who her cabinet secretaries are and her ministers are, but the roles that they should focus on. I am very focused on making sure that before I depart, we have a well-run, well-delivered vaccine programme, that we are testing as much as we can and as many people as we can in a way that will make a difference to our capacity to deal with this virus and add value to all the other work that we're doing, and making sure that we are providing all the support that we can to those vital health and social care staff. So I'll get on and keep doing that job, and hope that what I leave when I leave in May is a service that is as robust as it is right now, as able to cope, and as proud as it should be of everything that it has achieved. Michael.
Hi, good afternoon. Regarding the potential for extended school Christmas holidays. There's already a lot of pupils that have missed quite a lot of class time because of self-isolation or because of illness. Would you be worried about the impact that any extended closure, even just a few extra days off, would have on their education? And also in terms of, since you're considering quite major plans like this, those areas in level 4 lockdown, which comes to an end on the 11th of December, can they really realistically expect much of a relaxation of the restrictions that they currently face on the 11th of December? Thanks.
Thanks very much, Michael. In terms of what at the moment is entirely the right job of the expert recovery group, and that is to look ahead, to look at the current situation in terms of schools, to look ahead at events, if you like, that are coming, which in this instance is the normal school holiday break around the festive period. That's their job. That's what we would expect them to do. We shouldn't read too much into what they might or might not conclude. We should wait for them to give us their advice and for the discussions to continue between the Deputy First Minister and school staff and our local authorities. Always, all of us focused absolutely on the importance of keeping our schools open, because we value very highly indeed the opportunity that gives our young people to pursue their education. Now, we know that closing schools, as we had to do at the time when that happened, did have an impact, notwithstanding the huge efforts that teachers and indeed parents and children themselves, pupils themselves, put into maintaining their learning. The best place for young people, children and young people, to pursue their learning is in the school environment. So we will take all the steps that we need to take to ensure that that is as protected as possible. But until that education recovery group, that expert recovery group, reaches its conclusions and offers its advice, and the Deputy First Minister sets out the steps, if any, that need to be taken, then we're simply speculating on that. And that's not the best place for us to be. We will make sure, I know the Deputy First Minister will make sure that he reaches a view based on all that advice as quickly as he can, so that parents, children and young people and the staff who work so hard in schools know what is going to happen around that festive break. And in terms of level 4, that is even more speculative, because we said level 4 areas for 3 weeks for a reason. We needed 3 weeks to try and suppress the virus in those areas as low as we possibly could. Not because of Christmas, but because we know that winter always brings additional pressures onto our NHS, January, February, through into the end of winter. So we want the virus to be as low as possible to protect our NHS so it can cope, but also because high levels of the virus mean more people are ill and more people are at risk of dying. So the level 4 decisions are constantly being reviewed. We look at those numbers all the time. You know, there is a weekly statement by our First Minister about where we have got to and the decisions, if any, that we've taken from one week to the next. And we'll continue to do that week on week. It actively involves clinical advisors like Fiona, our Chief Medical Officer, our National Clinical Director, and others, giving us their expert advice. We'll do it week by week. And as we get closer to the end of that 3 weeks and we're ready to set out where we think we go with level 4 areas, and indeed the other local authorities on other different levels, then we'll set that out at that time, because that will be the right time to do it. Tom Peterkin from P&J.
Good afternoon, Cabinet Secretary. Students who come from islands have expressed concerns about getting home for Christmas, you know, with their logistics of ferries, limited capacity and flights and so on. I just wondered if you could give us an update on the latest on testing for students, and B, if you can guarantee that island students will get home if they want to.
So I think as viewers probably know, students who are travelling home, we expect between 60 and 80,000 of those are encouraged to take 2 tests before they do leave to travel home. And that testing, with a lot of support and hard work from our universities and others, has started. Some have started today and certainly will be running from next week, so that students can have that assurance that they have had those 2 negative tests. Obviously, if they test positive, then they need to take the right steps in order to isolate for the required period before they travel on. So that is underway and is in place. And as I said, it's thanks to a great deal of work. And I would encourage all students who are intending to travel back home over the festive period to take up that opportunity, because that allows you to know that as you set out home, then you are negative at that point for COVID-19, and that will matter to you because you will want to look after your family, particularly if you have elderly relatives. In terms of students going to Ireland, the travel relaxation has been clearly set out. I can't guarantee that all students who want to return to Ireland or indeed to any other part of the country will be able to get there. That would be a false guarantee, because it's not one that I can give. But the testing is there, the relaxation is there, and I'm sure that students, like others, if they intend to take up the opportunity of the relaxation over those 5 days that have been offered, will be planning to do that and making the arrangements that they need to make. And all I would say to them is, as you travel home, as you meet your family, as you spend time with them, stay as safe as you can. You know what you need to do. Stay as safe as you possibly can. And David Ball from the Herald.
Thank you, Cabinet Secretary. The Christmas guidance that was published yesterday mentions that people in shared flats and shared houses shouldn't go home and form a bubble. I was just wondering if that is counterproductive, given the aim of the relaxation is to cater for sort of fears over isolation, and whether it is sort of realistic to expect people who essentially live with strangers not to be able to go home and meet with loved ones.
Well, I'm not sure that it is entirely fair to say that people who are flat sharing are living with strangers. But, you know, this is a difficult situation, and these are difficult circumstances for us all to be in. What we are trying to do is set out a time-limited period of relaxation of restrictions, so that people can decide within that period what they can do to keep themselves and their loved ones safe. And we're saying very clearly to people, if you can go through Christmas without spending time with your family, then please don't. Please do stay at home and see them later when it is safer to do that. But as I've said, you know, part of the purpose here is to try and recognise that for many people, Christmas is a very lonely time indeed. And therefore, family and friends might want to ensure that their loved one is not as lonely as they might otherwise be. There is no absolute correct way and absolutely wrong way to do this. It's like everything else that we've been trying to do for the past 10, 11 months, and that is reach a balance of judgment about what is the safest that we can do. So we've reached those 5 days over that period with the relaxations that are there, and we're being really clear and straightforward with the public in Scotland, with all of you watching, as I know you would expect us to be, in setting out what the risks are of that and what you can do to mitigate those risks. And I am confident that you will make the right judgments, the sensible judgments, the safe judgments for yourself and for those that you love. And finally, Kenny McBride from Broadcasting Scotland.
Good afternoon, Cabinet Secretary. I'm afraid Kenny can't be here. He's got stuck in the transport somewhere, but it's Linda Graham in the control room. I just wanted to ask, we've spoken with a single mother who has been denied the £500 support grant when her 8-year-old son had to self-isolate after someone at his school tested positive for COVID. She was told that she wasn't self-isolating herself, so she's not eligible. this is despite her being, having to go to work and get someone, go to work. It's now been twice in 6 weeks. Our son has had to self-isolate. Is there support available for single mothers who have to self-isolate when or where their children have to self-isolate?
So thank you very much for that, and I hope Kenny gets out of the traffic that he's stuck in fairly soon. Obviously, I don't know the details of the particular individual in the case that you're telling me about now. If you want to, and if the person is happy for you to give us those details, then I'm very happy for us to look at it and for us and those who are charged with that support grant to look at this particular situation, but to look more widely at potentially the issue that you might be raising here. But other than that, it would be entirely wrong for me to be more specific in this instance at this point until we have that information. So please ask the lady concerned if she is content for you to pass on her details to us, and we'll look at that particular circumstance. Thanks very much. That's all the journalists for today. I'm grateful to them all for joining us. My thanks to Fiona, our Chief Nursing Officer, for joining me too, and to Rachel, our BSL interpreter. As always, we're very grateful for the work that they do. And most of all, my thanks to all of you for taking the time to spend with us this afternoon. As always, please remember the facts guidance. Please practice that. Face coverings, making sure that you avoid crowded places, that you clean your hands and hard surfaces and touch points in particular, door handles, light switches, all of that. And if you have symptoms, then isolate and book a test immediately. Please stay safe and thank you again very much indeed. Thank you.